It's myself and Graeme Gotz, who is the Director of Research Strategy at the Gauteng City region. Graeme is going to do the first half of the presentation, and then I'll come in the concluding half. So it's over to Graeme for the first half. Graeme, over to you.
Great. Thanks, Rob, and thank you very much to the organizers for the opportunity to present to you today. As I said, we'll share this presentation. I should just say that Rob is the outgoing Executive Director of the GCRO. He'll be leaving us in about a week's time, so this is going to be one of his, hopefully, many swan songs. I'm going to talk very quickly about the research and the research questions. This work was informed by a host of different points of data collection. We did formal interviews with around 15 respondents. But in addition to that, we've been quite heavily involved in the Gauteng provincial government's response in various ways. So in particular, as part of the Premier's office led data and analytics work stream, we did a lot of work supporting the processes of accessing data, mining data, and so on. Dr. Moore was nominated by the Premier to be part of the Premier's Advisory Committee on COVID-19. And as part of these and other engagements, we had a host of informal discussions, which of course proved extremely useful in their own way. Together with GPG, we organized 2 governance dialogues on responses to the pandemic. There was a panel session co-organized with Professor Phil Harrison and others at the South African Cities Studies Conference on the 31st of August last year. And we do have to note that this was only one of many forms of engagement that we've had with Phil Harrison, who is the author of the Governance and Leadership, one of the authors of the Governance and Leadership chapter in the National Country Report. Mea culpa, we should say that we're looking at a vast apparatus of government, and so it's obviously not possible for us to cover every component of this. Some might ask, where was what I was involved in? We're only giving one lens on this. We do ask critical questions, but this is not intended as an appraisal, an evaluation, a critique. Our purpose is to illustrate the complexity of adaptive governance responses. And we do have to signal our appreciation to the many people who have assisted the study in various ways. So the research questions for the study were framed in part in response to something that Professor Phil Harrison said at one of the governance dialogues last year. He said, during a crisis like this, governance is tested to the extreme. It throws into sharper relief than ever before the character, capabilities, and limitations of governance. And it exposes pre-existing flaws, capacity limitations, and rigidities and fault lines. But even while what? Okay, so let me just reduce that. Okay, that's actually my visuals of the rest of the team presenting. Apologies for that. So taking impetus from remarks from Professor Phil Harrison, we shaped up a series of research questions. I've noted the negatives highlighted by Phil, but also the crisis reveals adaptive capabilities, relational strengths, the commitment and quality of individuals, leadership potentials, etc. So when we set out to do the study, we asked a number of different questions in light of this. To what extent did the COVID crisis expose existing weaknesses relative to the extent to which it enabled an opportunity for reset? And the answer is a dynamic one with both narratives of success and failure. Therefore, in turn, to what extent was dynamic leadership able to overcome well-established institutional practices and cultures that were revealed or shown again as unfit for purpose? In other words, to what extent was government able to publicly demonstrate agility, speed, and responsiveness? And then differently, there's a different question here. To what extent was it able to be adaptive in the face of inherited accountability systems, arrangements, and organizational values and day-to-day routines that typically inhibit the setting of cross-government agendas. Now, in doing this research and on an ongoing basis, we continue to look at international literature that's asking similar questions. I'm not going to go through all of this, but just to say that there's a lot of writing on this kind of stuff internationally at the moment, and similar conclusions are emerging from that literature. There's a common theme that the pandemic has revealed strengths and weaknesses. There's a key distinction emerging in the literature between agility or swift decision-making and, as I've said, adaptiveness, which is structural capacity to respond to change. Researchers often observe residual stickiness of routine systems or poorly regulated system inhibiting the shift to adaptive capacity. There are notable examples internationally where administrations have taken political advantages of the crisis. And I want to highlight the quote on the right from an author researching the situation in Israel, where he shows that apparently bad governance, in fact, reveals a careful political calculus underlying government decisions that are meant to promote a messy environment in which control can be exercised from the top, which limits the ability of others to interfere with an agenda that is more forceful as a result. So I just want to talk very quickly about some of the structures and systems established. Carmel covered some of this yesterday, but it's worth going over this ground before going into the more analytical stuff. As with national governments, the Department of Health in Gauteng did establish some capability before the crisis struck in anticipation. However, when national disaster was declared in March, there was a recognition that an all-of-government response was needed. And new structures were established very quickly, building on existing disaster management arrangements. And there's this diagram that's used everywhere all the time, which shows that the Gauteng arrangements, in some ways at least, in their conceptualization, were meant to slot into a cascade of command councils and command centers in all three spheres of government, which was predicated on the idea of enhanced connectivity vertically from the centralized National Command Council. However, it is fair to say that these disaster management arrangements were not really the way things worked out in practice in a full sense. There's a really useful quote from someone in the governance dialogue who says, our so-called provincial disaster management center was actually in its physical architecture completely inadequate in a whole number of ways, and leading to a situation where we rapidly moved out of the building with its systems that was meant to be purpose-built for this kind of function into a different set of arrangements. And indeed, a whole bunch of new arrangements were established that, in a sense, reflected on the idea of disaster management, but were, in fact, innovations in their own right. So the governance arrangements are possibly best understood as an amalgam of disaster management capabilities and a program management model that was actually designed on request by the Gauteng provincial government by Deloitte, who gave a lot of time on a pro bono basis to the development of these new arrangements. These structures were orchestrated politically by the Premier, orchestrated administratively by the DG and the MEC for Health, what was called the Provincial Disaster Management Command Center, or War Room, meeting daily at 3 p.m., then bi-weekly later on when the crisis lessened. There was a specific emphasis on cross-sphere cooperation, which was orchestrated through the Provincial District Demand Council, which was meeting weekly. And then following, as I've said, the request from GPG, the design of a program management office, which held all this together. The PMO was conceived as an interruption of the vertically integrated but separate parallel departments and agencies, and its replacement with an interdepartmental, horizontally integrated set of functional areas called work streams operating in alignment by means of the coordination of the war. And this was meant to bring the various political leaders and administrative heads into close dialogue with each other. There's a diagrammatic representation, which I'm not going to go into. Note, of course, what Carmel mentioned yesterday, the different work streams interfacing with quite a large centralized office in various ways. I want to point out the planning unit that was conceived of there. The PMO tends to be referred to as both an office, a secretariat function with key staff, and also a way of working transversally across previous silos. And the war room it needs to be thought about as both a structure, a process of strongly managed daily meetings, and to some extent also a physical center. Now, there were some natural evolutions in this over time, so there was some figuring out. For example, could the provincial command center take executive decisions, or did it only refer decisions to EXCO? It has to be said that when Deloitte handed over, there was some organic evolution of the model. For example, a data analytics and research work stream that was conceived and then pioneered by Mdu, amongst others, was established under the leadership of the head of the policy unit, that's Mdu, involving membership of a whole bunch of different players, including the GCRO and people from universities. Rather than a planning capability fully staffed within the PMO, there was this understanding of the need to bring various players outside of government into alignment with each other to maximize skills from various quarters. Some aspects of the model only evolved much later, such as donor coordination. We should note the role of the Prov joints, and the military in particular is important here. At a key stage, the military under a particular general who had been part of the war room processes throughout became more operationally involved in order to supplement available capacity. Later on, there were ward-level approaches to hotspot management through ward-based war rooms. Ministers were deployed to specific districts and metros, which is seen as part of the evolving approach to DDM that is augured in some way by this new set of arrangements. And then, of course, we need to note that some of this showed significant innovation. The directives that followed the declaration of a disaster envisaged district-level command councils, but it's not clear that they foresaw a provincial district command council in the way that that worked, bringing the Premier together with the mayors. Now, my last slide, before I hand over to Rob, just talking about what we think worked well in all of this, and then Rob will talk about some of the things that didn't work so well or maybe could have been improved upon. It's certainly worth highlighting the significant leadership agility. The Gauteng Premier's office realized quickly that existing governance arrangements were not equipped to deal with the crisis presented, and those included the existing arrangements around disaster management, as I've said. New governance structures to achieve horizontal convergence were formed very quickly. It really is noticeable how fast these were forged. At a political level, top provincial and local government leaders met with unprecedented frequency, and a lot of our respondents noted the point around mayors and municipal managers being in rooms side by side with provincial officials and leaders in a way that had never been seen before. The important role played by the Director General in driving coordination, and there's more I could say here about the way in which a Director General of a province plays an all-of-government, cross-government coordinating role as opposed to their responsibilities to head the Premier's office. There were a number of respondents who noted how, and I'm pointing at one of the quotes on the right, the DG exercised immense leadership. She provided the vision for what was needed, and she brought people together in a very systematic way, driving cooperation where sometimes there was reluctance, as Rob will speak to collaborate. The Premier's office launched a number of initiatives later on in the process, which has to be noted. The Premier's Advisory Committee brought in external experts, the governance dialogues, the deep dive case study, of course, which this is a part of. Towards the end of 2020, the Premier also announced a task team to, and in some respects, we note what has worked well is that all of this has allowed the various players to see alternative models and ways of working in operation, which has excited appetite for reform, especially at the city region scale of governance. I'm going to hand over to Rob at this point, who will talk about some aspects which did not work so well.
Thank you very much, Graeme. Thanks. I think the point has been has been made, but it's well worth repeating, is that at the level of the Office of the Premier, and this was from the Premier himself, from the DG, but from the staff of the Premier's office, there was an ongoing, relenting energy of innovation, of oversight, and of an emphasis on learning, of trying to generate a culture of reflection that was persisted throughout 2020 in order to say what's going on, how do we understand what's happening, how do we understand the impact of the epidemic, and how do we understand how effective our arrangements have been. So there was a huge emphasis on trying to learn and understand. At the same time, there was a kind of a consciousness that not everything was going as they had intended. There were some key areas where there was visible frustration. There were some really important domains where there were some significant problems, and it was in fact in some key departments that were absolutely central to the response to the pandemic that seemed to be unable to respond with the adaptive agility that was needed. And that they seem to resist the kind of cross-departmental, the associative ethic that was required by the model that had been set up for the response to the thing. And the quotes in the side, all of these are quotes from people that we interviewed for the deep dive case study, sort of indicating some of the responses there. So even though the DG was exerting this leadership all the way through, she was having to work in some cases against pushback, against resistance, and she was having to work with kind of departments, central departments, that were reluctant to work with the project that was there. Although this new structure had been set up, and Graeme reminded us of this new integrated structure that was set up in a very, very determined way in order to achieve this kind of coordinated, clustered arrangement that brings together the different functional arms of government. Nevertheless, what that represented was a destabilization of how the streams of authority and decision-making and flows of information in the past functioned. And that destabilization meant that there was some interruption in the flows of decision-making and activities of government. And it took a while before the new systems began to establish themselves in fully appropriate ways. And it kind of took a while for, if you like, the new model to begin to establish itself. Could we have the next slide, please? Some of those. What was interesting was that although there was an intentional design to the model that said, if we create the structures in a particular way, this is how it will work. It took some time for those structures to actually take effect. And what we found out, interestingly, was that the collaborative dynamic, the associative dynamic across the functional areas of the departments began to take place in organic ways. In other words, it was certain individuals with that associative disposition began to connect with each other and began to work across each other in kind of very, very interesting ways. And that was a very important thing. It begins to point us to the issue of the kind of capability of individuals that are suited to this form of adaptive governance. A very interesting area of dislocation was between provincial government and local government. The kind of cross-sphere coordination worked extremely well at leadership level. So those structures where we had the mayors and the municipal managers sitting together with the top provincial officials, those structures seemed to be very energized and working extremely well. But what worked less well was the ongoing flows of communication and decision-making on an ongoing basis between province and district level in terms of decision-making. And there, that sometimes worked well and sometimes didn't work well. And there seemed to be some confusion and sometimes breakdowns in kind of communication. So, for example, sometimes that found effects in breakdowns in, for example, the delivery of food relief. Sometimes you would have a failure of delivery of food relief in some areas and then over-delivery of food relief in other areas. What was a particularly painful and difficult area was the issue of data. And there was a very, very deep reluctance, and this was very, very apparent from the Department of Health. A huge, deep reluctance to share data that was needed. So we can speak very, very personally from the perspective of the GCRO, where we were asked to be a partner to assist with data analytics, and yet there was a very deep reluctance to share the data with us that would enable us to actually do the data analytics. So this was a very, very serious impediment to the partners with government, but a very deep impediment to colleagues within government as well. There was a very, very serious weakness in terms of just the flows of data, but it also pointed to a very great weakness in the ability of government to be able to be data savvy generally. In other words, to be a properly digitized government kind of capability. So that certainly, I think, needs to be one of the domains that we need to look at very, very carefully into the future. Next slide, please. So some of the key features that we need to be thinking about, this is if we're thinking about adaptive governance into the future, and I really want to appreciate the point that was made by Bangani in his summing up at the end of yesterday. He was saying that a lot of what we were talking about yesterday is pointing ahead to say, how should we be thinking about the developmental state into the future? And a lot of the learning that is coming out of this experience of the pandemic is very, very relevant to how we create the adaptive capability for a developmental state. And so the kind of analysis and insight that we are generating at this point is to say, how do we understand what was going wrong, what was inhibiting our ability to be adaptive? And I think that what we're trying to do here is to begin some of that analysis. And so I think that some of the points that we're making here are pointing to that. And so the first bullet point that I'm looking at here is that an adaptive system at a time of crisis that stretches across 3 different tiers of state and across multiple functional areas of government needs to depend on functional relationships between officials with shared common purpose. and preferably a high degree of trust. And it was really interesting that this came up in some of the presentations yesterday, most particularly in the presentations from the Western Cape, where they pointed out how the nature of the relationships between officials in the system was a very, very significant factor in where they succeeded or failed. And so I think this is a very, very important aspect, functional relationships across the various different functional areas and the tiers of government. The second bullet point we're looking at here about the higher skills levels. I think that being able to work across boundaries, being able to work across different functional areas, across different areas of kind of authority and discretion, requires individuals with particularly high levels of skill, individuals who are able to operate at high levels of synopsis, synthesizing, and being able to have high levels of discretion, high levels of authority, and certainly thinking about that. Certainly in terms of being able to work with data, we know from within the GCRO ourselves is very, very often some of the data analytic work that we are doing involves groups of colleagues within the GCRO to be working on particular problems in order to generate insight around things. So we must not underestimate the kind of skills that are needed in order to be able to bring the right kinds of insight to these things here. We also must not underestimate what the demands of routine government. This is, and I really do not want to diminish the importance of routine government. Routine government is essential to be able to carry out the normal, everyday functions of routine government is absolutely essential. But we need to be able to build adaptive governance alongside routine government. But routine government can exercise a very, very powerful gravity, and it's quite possible that routine government can slow down the development of adaptive government. And certainly under the conditions of the pandemic, where we had to put adaptive governance in place very, very quickly, and it's very easy for the gravity of routine government to slow down the development of adaptive government, particularly when routine government has to continue to operate and to deliver on its own mandate. It's also important not to underestimate the resistance from individuals who already have existing interests in a whole series of different ways that are implicated in those existing structures. Second last bullet, very important, I think, in terms of the Gauteng Department of Health, is not to underestimate the legacies of failure. I think that this is only partially understood, but there may well be a situation where previous disasters in that department have not yet been adequately addressed and dealt with. Colleagues might remember the Esidimeni tragedy. They don't know yet whether that has been fully addressed and dealt with. And it may well be that there are issues of a fear of failure, fear of exposure, and a set of responses that are in that department that led to certain kinds of reluctance and certain kinds of cultures and behaviors that became apparent during the pandemic. But what was really clear, though, was that the strong leadership that was coming from the Premier's office, from the Director General, enabled the emergence in this organic fashion enables certain individuals to be able to exercise leadership and to be able to reach out to one another. And that we were able to see the emergence over time of this adaptive disposition, and that really made the difference and really enabled the extraordinary performance that we saw in Gauteng, in spite of some of the difficulties. So the points I've just been looking at here has been trying to understand those areas of difficulty that were experienced in spite of the other very much more strongly defined areas of adaptiveness that were exercised. Can I have the next slide, please? This is the last slide, and this is looking ahead. And this is to say, if we're thinking into the future, how should we be thinking about adaptive systems going forward? And we will be needing to think about how do we begin to assemble adaptive capability alongside the routine systems of government. And as I've said before, the routine systems of government are not to be underestimated. We need to keep them going. And the argument that I would want to make is that some systems of adaptive governance should probably best be built in partnership with the universities and with selected civil society and private sector actors. So, for example, we might have a Department of Transport having a relationship with a couple of key university departments that are specializing in public transport, and they are setting up a permanent network of research relationships around public transport, another set of relationships with engineering departments looking at roads and kind of traffic systems, and they have these networks that are more or less permanently set up in ways that we've got strong relationships that are built on research, on training and assistance, etc., and that one is working and each of the key functional areas of government that are looking to be adaptive are working with key partners outside of government. We should be looking then at a series of other capabilities. I think that we should not be thinking of adaptive governance necessarily as some neat model or template, but rather as a series of capabilities that kind of need to be available, and that what might be an adaptive arrangement might look very, very different in the different functional areas or the different geographic areas of government. But some of them might be captured in some of the bullet points that follow here. So major emphasis around digitization and data capability. It's absolutely crucial that we need to be building the systems of data analysis, data transparency, and the interoperability. It's absolutely a crucial message that came through from virtually all the presentations yesterday. And that seems absolutely right. It's also crucial that we are looking ahead, that we have some sense of what some of the things that might be happening into the future, and that we try and develop the ability of anticipation, of trying to be looking ahead and trying to understand what might be coming down towards us. We need to understand that the future of government is about relationships within government, across the departments of government, across the spheres of government, but also between government and its social partners. And the ability to establish those relationships and sustain those relationships over time requires very, very much the ability of brokerage, of facilitation, of mediation, and that capacity is a very, very important capacity. And we might be underestimating how important it is to have that capacity available in government in order to ensure that relationship building within and beyond government is essential. And that includes relationships with communities. A deep investment in the strong project management and the physical engineering skills. We do need these skills within government and beyond. Absolutely crucial that we can go out there and physically do stuff in the environment. This particularly was important even in a pandemic, but will be equally important in climatic and other environmental crises that will be on the way. We need a strong investment in a social analysis, in understanding what is happening in society. Some of our future crises will be social in their form. If we think about migrancy, if we think about xenophobia, if we think about gender violence, etc., we need to be understanding what is happening, how we deal with that, how we communicate with our communities, and how we deal with these things. There were some very, very interesting examples coming out of yesterday's presentations we could be picking up on and thinking further about. We have to be looking at how government communicates with itself, vertically and horizontally, and how we be organizing ourselves in order to achieve priority purposes, priority projects, and how we design our infrastructure in order to support those purposes and projects. By infrastructure, I'm thinking of the digital infrastructure, the information flows, the financial, the fiscal infrastructure, the regulatory, relational infrastructure that is set up in order to enable a particular purpose or project to succeed. We need to move in and start innovating around adaptive structures and functions. We've already started doing so for the pandemic, but we must start moving beyond the pandemic and start building adaptive innovations now for other things beyond that. We cannot have a plan to eliminate pit toilets in schools that stretches as far as 2030. We could surely have a plan that says all pit toilets will be eliminated in the next 18 months and pull together our facilities in order to do that. What we need to do is to start building adaptive functions structure now, but to do so, to have some kind of a tolerance for failure. I think at the moment in the public service, there's a terrible, terrible fear of being found to have, in some way or another, to have a finding from the Auditor General. And that fear of a finding from the Auditor General is a paralyzing fear. And somehow we need to find a way around that opens up and releases the ability of people to innovate and to take action. And so I think that what we need to be doing as we start thinking about the professionalization of the public service is we need to start thinking about perhaps a school of adaptive governance. We need to start building a cohort of skilled public service professionals who can work in associative, boundary-spanning ways, and who are going to be building the adaptive government of the future. Thank you very much, Chair.
Thank you very much for those reflections from Rob and Graeme. In this reflections exercise, we're going to be joined by Michael Sachs, who is a professor at Wits University School of Governance. But perhaps before I move over to Michael Sachs there, I have a question for you, Rob. You talked about resistance from certain departments. We know very well that when you are driving a project of this nature that involves multiple stakeholders, not all of them will readily jump onto the bandwagon. I would like to hear from you as to how did you deal with that resistance? what were the key driving factors to deal with that resistance of some of the stakeholders? Can you hear me, Rob?
Yes,
Oh.
yes, I can. We in the GCRO were partners to government, and so when we were experiencing frustration, we obviously did not have any personal authority, to deal with these things, and so we would need to work with our the kind of colleagues that we had direct contact with in the Premier's office or in other parts of government. So we would have to work diplomatically, if you like, and over a period of time. So, for example, our frustrations with data, which was a frustration that lasted over many, many months. We had to work diplomatically through multiple channels over an extended period of time, and eventually we're in a position now where the data situation has improved. It's still not ideal; it's far from that, and I'd be happy to let Graeme kind of comment on that. He's closer to that than I am, but it's still a curious situation, and I don't think that we fully understand why the situation is as it is. But one has had to work in very careful ways, because being a partner of government, one wants to maintain strong, positive, collaborative relationships, and still achieve what we're setting out to achieve. So perhaps it's a question that could also be addressed to our colleagues in the Premier's office, who are also having to work extremely carefully in order to overcome the resistances and hurdles that they were encountering.
I don't think they can hear us.
All right, like we say, we'll move over to Professor Michael Sachs, who is an adjunct professor at Wits University School of Governance and former DDG in the Budget Office at the National Treasury. He's going to also offer us some reflections on the issues of governance and leadership.
Thank you, Thabo. I thought you were going to say I'm a former DDG at the of the Premier, which I am too. But but I left shortly before this crisis, and so I observed this crisis from the outside. And so what I'm going to say is more of a reflection of how it looked from the outside, and on some of the themes that have arisen this morning. And I think that the thing that is running through my mind is the dialectic between crisis and normality, between a moment of disruption and a moment of normality, between the ordinary and the extraordinary. And one analogy maybe between these two states of the world is between war and peace. So we have seen in times of war, societies disrupted, and then there are lessons learned for times of peace. So earlier on, I think it was Rob who said in his presentation that it became apparent that some of the existing arrangements were not fit for the crisis. And so new arrangements had to be invented. But we should also be asking the opposite question, which is, are the arrangements that are established during a time of crisis fit for addressing the issues of normality? And we should be very careful not to draw the wrong lessons. Let me give you an example of what I mean. During the Second World War in Europe, cities were bombed indiscriminately in the kind of way that we have seen Israel bombing Gaza in the last week or so. This happened to London and Berlin and many cities. And in that crisis, the boundary between public and private provision of healthcare was eradicated, because the extent of suffering and death was so deep that no doctor, no health worker could say, no, well, I'm a private sector doctor. They simply had to attend to the dying and the wounded. And under the command of the public authorities, the government authorities. And this meant that after the war, the basis of a public national health service was laid. And so the kind of public health systems that you saw emerge after the war were rooted in that experience. On the other hand, another thing that happens during a war is that the military takes over. And kind of civilian leadership is put at the backside, democracy is set aside, and command and control rules the day. And it's lucky for us all that that type of lesson was not adapted for conditions of peacetime after the war, and that Europe remained democratic. So again, I'm asking this question, okay, existing arrangements were not fit for the crisis, but are the crisis arrangements fit for a time of normality? I think we have a very strong, very deeply embedded preference for crisis in South Africa. We like it. Why? Because it resolves many of the problems that we face in our everyday lives, especially in the lives of government. It ensures that we focus on what is urgent rather than maybe what is important, because it imposes urgency on you. You know, I heard Ishmael say earlier on that maybe we can argue that unemployment is a crisis. And I thought the very fact that somebody says that demonstrates the fact that unemployment is not a crisis. Because if it were a crisis, we would not need to make that argument. Because the crisis imposes itself on you. It doesn't need to be argued for. It simply imposes a logic of the urgent on everybody. So the central problem of government in South Africa, in my view, over the last 30 years, has been the problem of priority setting. And crisis resolves the problem of priority setting. You no longer have to ask, what is the priority? Is it unemployment? Is it climate change? Is it gender-based violence? And focus on one and set the others aside. We knew that the crisis was COVID and we had to respond to it. and no other priority could tangle with that determination. So it resolves the problem of urgency and importance. It resolves the problem of priority setting by imposing a priority on us. It also resolves the problem of the political and administrative interface. Because as you go into a crisis, as you go into a war mode, the challenge of a good relation between the political becomes operational, and the operational becomes political, and the two can be fused together. But whether this is a good model to emulate during a period of a non-crisis, I'm not sure. So again, this is my central question: is the existing arrangements were not fit for crisis, but are the crisis arrangements fit for non-crisis? It's clear one of the things that has come out of the discussion is it's during the period of routine, of normality, that we build systems, that we build capabilities, that we construct relationships. And to the extent that this has not been done during the period of normality, our crisis response will suffer as a consequence. And from the outside, this was patently obvious in Gauteng during the COVID crisis, because there were two events that took place during the crisis that showed how the failures to construct effective capabilities during normality disrupted our response to the crisis. The first was corruption in PPE, which, as far as I could see, and without wishing to comment or judge on the outcomes of various legal processes, but as far as I could see, the Department of Health approached procurement in the crisis in exactly the same way as it had approached procurement for the last 25 years, with the political administrative interface and boundaries upset. But what the crisis meant is that approach, that problem of procurement that has bedeviled the department for 25 years and was not regarded as an important problem to solve, apparently, because it was not solved, suddenly became unacceptable. And hopefully we can learn from that and use this experience, take this forward out of the crisis into the non-crisis to ensure that procurement systems do change. And those problems about the political administrative interface in procurement systems are addressed. The second big revelation of the failure of peacetime systems in the course of the crisis was, of course, the fire at Gauteng's probably most important hospital, which has closed down that hospital. Which again shows, and I mean, this is again a repeated problem within Gauteng of failed maintenance. I mean, a few years ago it was the fire at the Department of Health building, which again was the outcome of many years of failure of maintenance. That then, unfortunately, now closed down a major health facility in the midst of a health crisis. So hopefully we will learn from that as well about how we think about what we do in times of normality and how this will impact on whether we can respond to a crisis. Yeah, I think maybe I will stop there. and because I think I've made some points, and I hope I've contributed to the discussion. So thank you very much. For some reason, I don't hear the feed from the studio there. Sorry about that.
Yeah.
Thank you for highlighting that. But I'm sure it will be addressed. Thank you for highlighting that. As part of the reflections, we'll also be joined by Phillips, who is the head of Operation Vulindlela unit at the National Treasury.
Good morning, colleagues. I hope you can hear me.
Yes, we can hear you.
Thank you. Yes, the problem that we're dealing with is essentially one of political and administrative management of an emergency or crisis. And I think generally South Africa has not generally been good at managing emergencies and crises. One of the problems is at both political and administrative leadership level, we're often too busy to pay attention to the important things. We have a tendency to somewhat bizarrely carry on with our usual activities and ignore the crisis, while the crisis has the potential to undermine all of our other work. Our other key problem, I think, is that our top leadership, again, both politically and administratively, tend to not be hands-on enough to manage a crisis effectively. And they tend to not want to get their hands dirty and resolve issues and leave the detailed work to people at lower levels who don't have the authority to make things happen. In a sense, we have a bit of a problem of a misunderstanding of what strategic leadership is, and that we sometimes think strategic leadership means not getting involved in operational issues, when particularly in a time of crisis or emergency, strategic leadership is precisely the opposite. You need to get involved in operational issues to resolve them. So just as a couple of examples, during early 2000, I was head of Department of Public Works in Limpopo, and there was the February 2000 floods, which resulted in communities being completely cut off for days on end with no access to food or medical services. And the normal disaster management processes were kicked into place, and the Provincial Joint Operations Centre was put in place under the leadership of the military. And I was part of that process, and we were trying to get things to happen quickly, and we were trying to get decision makers from key departments to come to the JOC meetings to help us to be involved in the decision making. And some of the key decision makers, accounting officers from departments, indicated to us that they couldn't come to the JOC meeting because they were in strategic planning sessions developing their APPs. So that was quite an eye-opener for me. I think another good example of where we're not really handling a crisis well is the electricity crisis in the country at national level. All projections are that we have an electricity shortage which is going to continue until at least 2024, which means that ongoing load shedding is going to negate all of our other efforts to get out of our economic situation and to have an economic recovery. And yet there doesn't seem to be a sense of urgency to resolve the electricity crisis and to identify additional actions which could be taken to get us out of the crisis situation. I think in that context, Gauteng appears to have done relatively well in managing the COVID crisis, from what I've seen of the case study, the presentation. The DG of the province seems to have provided much of the strong central top-level leadership and hands-on management that's required to force departments to respond. I also think the silo challenges that are identified in the case study are to be expected and have to be managed. And that can, again, only really be done through strong top-level leadership. My only key concern or criticism from what I've seen in the case study is that it appears that the existing disaster management structures in Gauteng didn't work well. So alternative structures were put in place. An alternative PMO structure was put in place. But I think we need to be cautious about setting up alternative structures when the responsible structure isn't working, instead of fixing the responsible structure. Perhaps Gauteng had to do that for this crisis, but I think Gauteng should try and fix the responsible structure before the next crisis so that you don't have to set up an alternative structure again. And similarly, it would be preferable to get executive managers with decision-making powers in the responsible disaster management structure, rather than setting up separate decision-making processes and structures. As Rob indicated, it takes time to set up new structures, and you don't have that time in the context of a crisis or emergency, and it should be more effective to use existing structures if they work. So in conclusion, I would just say that top administrative and political leadership and drive is key. And it should be accepted that it's going to be necessary to overcome resistance to change and resistance to doing things differently and with urgency. Thank you.
With those comments, and thank you to also Professor Sachs in giving us the things to ponder upon. On that note, I welcome Mr. Rashid Sidat, who is the head of the Delivery Support Unit from the Gauteng office, and perhaps you would like to make some opening remarks there, linked to the comments from our panelists.
Okay, firstly, good morning everyone, and thank you for attending this session. I think it's really appreciated. I think we heard fairly extensive views from Graeme and Rob and Mike and Sean, and I think they have provided us with I think a lot of food for thought. Let me start by wishing Mike a happy birthday. I think his birthday was yesterday. So Mike, happy birthday. I think it's 50th, if I'm not mistaken, Mike. And so you've reached a very important milestone. And I know Mike, when he puts up his profile, he often excludes the last year in government, which was in Gauteng, and that's why they didn't quote it, Mike, and you very kind of belatedly put that up, but we have to remind you that you were part of our team, and you made you may not know it, but you made a very important contribution. As for Sean, I mean, we've had ongoing relationships with him as Gauteng over the years, and I think that the fact that that Ismail Ekawaya and Sean have worked together in the past, I think has really helped us to solidify that relationship. Of course, with the GCRO, I mean, we work with them every day. I mean, I work with Graeme and Rob every day. And we have an extremely close relationship, given the nature of our partnership as such. Okay, I'm just told to redirect to a camera. Okay, is that better? I was looking at the colleagues on the screen. So firstly, welcome to everyone. I think that there has been a lot of food for thought. And I've made lots of notes. I'm not quite sure where to start, but I'm going to make a couple of sort of general points, which I think are sort of important for us to reflect on. I think the provocations that came from the colleagues are really important for us to learn and basically take things forward. And I think that's the only way that we have to understand this. You know, my view about what has happened in Gauteng over the last year or so has been a case of both the glass is half empty and the glass is half full. Because I think there have been very significant differences, advances, I think some of which Ismail spoke about in his talk, and I think we recognize those particular things. So I think we might want to, in the conversation, I think raise some of those, discuss some of those issues in a short while. The issues raised by Graeme and Rob, I think them being maybe closer to the action in Gauteng than our other two colleagues. I think, but at the same time, being sort of at arm's length also helps, because it actually allows them not to be sort of totally embedded and immersed within the Gauteng system, but they're close enough to have a sort of critical perspective on what's actually going on. So I think in that spirit, I want to raise perhaps, I mean, not just sort of regurgitate what has been said, but maybe throw some provocations. So continue the line of provocation, because I think that's the only way in which we're actually going to learn on some of these things. So the one thing I wanted to say, looking at my notes, is that, and maybe it alludes to some extent with what Mike was saying, or I call Michael Sachs Mike, so I'm sure you understand that, is really that my feeling has always been that we cannot be on a permanent state of alert and high alert. And yes, we're going to continue now in the foreseeable future, given the imminent third wave, and well, if herd immunity ever comes, hopefully there will be a normal and the so-called new normal. But I think that working in a particular way as we have, I do not think it's sustainable. And what I mean by that is that for those of you that are unaware, you might have heard it yesterday in the conversation, but I mean, we have, from where I'm sitting as a senior official, we have two meetings called the PDMCC, the Provincial Disaster Management Command Center, for 2 afternoons a week, on a Monday and a Thursday. We have the Provincial Command Council, which is the whole of a Tuesday afternoon. And then I chair, for example, technical task team, also to do with COVID, plus a work stream. So it's just not sustainable. And we have to be like sometimes 60, 70 people in the same meeting, the most senior people all the time. So, and in fact, as we speak at the moment, there's something happening in the West Rand where I'm supposed to be at, but I sort of ducked out. I'm not so really supposed to duck out, but we thought this was important in consultation with the DG. So, without making a speech, I think that is it sustainable, and I'm putting this to the panel, is it sustainable to continue in this way? I mean, there are very real and obvious advantages, and I think that those points have been made. And by that I mean, the fact that you have the most senior people, I think the points that Sean was making, having them at close quarters, Rob also made the same point, having them constantly there is and together, it might be on a virtual platform, but basically being able to speak to one another has been an important way in which we've been able to break down the silos between departments and on an intergovernmental basis as well. And I should add, and I don't know whether this point has come through, even within departments. Because sometimes some department, like our health department, I'll say that openly, I mean, it's such a massive institution that different sections don't even talk to one another. And this process has enabled us to actually begin to break down those particular things. So maybe that's one of the points I want to throw at the panel. I'm not sure if the colleagues who are online are able to answer. Are they able to communicate?
Yes, they are able to
okay.
communicate. In fact,
so maybe just throw it to everyone.
Sure.
To do that. Any takers on that issue?
We have invited them, those who want to comment the attendees. There is a Zoom link they can click on, or just type their comments or questions. Ismail wanted to respond to some of the comments you've made there.
I see, just before Rob comes in. So I think the question I want maybe to focus on is, can we have an approach where we have a coexistence of a routine government? So we know routine government is important, and we need to improve the efficiency and effectiveness of that. And that needs to continue irrespective of what happens. But I think what we've been arguing in the delivery unit in the Office of the Premier, can we signal out, isolate 2 or 3 key service delivery issues that operate on a different track, that have a different set of routines, that we can then use this lessons from adaptive governance to basically have focused political intervention to address blockages and to solve problems. So I'm keen to find out, in what we call normal times, can we have a coexistence of routine systems, but also have a space where we isolate and identify key service delivery challenges that we operate differently?
Great, thank you very much for that, Ismail. To say, if we are able to respond like this during crisis, so if we identify those hot spots, can we adopt the similar mentality? And I believe Rob wants to say a few words around that. Over to you, Rob.
Well, I'm perhaps just wanting to add to the question, and it's kind of responding to the points made by Michael and Sean, and the point just made by Ismail, and it was the question that you raised earlier, Chair, was how were responses made in the face of units or departments that seemed reluctant to cooperate? And I didn't answer that very well, because in fact the Premier in fact made some quite radical responses. He fired the MEC for Health, the head of department for Health resigned. Towards the end of last year, he appointed the provincial strategic support task team to support the Department of Health. So he's put in, he's done a whole lot of things to try and address the Department of Health. My question, though, is that I think that it's been quite difficult to address the Department of Health problems for quite some time. I believe that there are a number of reports going back 10 years or so about the Department of Health's issues. I think that, and I wanted to go back to Sean's point. He says, fix what's there, fix the existing systems. And I'm wanting to ask the question: are there some things that make it difficult to actually get into the functionality of existing structures, and slow down our ability to make even the routine systems work well, so that they have good routine functionality, let alone the ability to become agile and adaptive when needed?
Great, thank you very much, Rob. And you want to respond to that, Mr. Siddharth?
Yeah, no, I think the issue that Rob has raised is a very fundamental issue. It's one that we've been grappling with, and that has to do with the Gauteng Department of Health. I think let's be open here. It's no secret that the department has been facing many, many challenges. I mean, Michael Sachs himself, for example, was, for the time he was in Gauteng, had to deal with some of these matters. And what happened sometime last year was that the Premier appointed something called the PSST, the Provincial Strategic Support Team, to basically look at the structural challenges facing the health department. not the COVID response and PPE, the immediate issues that are with us. Those issues are being dealt with. But, I mean, we have very deep-seated issues. And the deep-seated, I mean, the fact that we had a fire, as Mike was saying, the Lisbon building, which housed the health department, other departments. We've had a fire at Charlotte Mckeke. We had a fire at the Carltonville Hospital, which hasn't been mentioned. I mean, those are just symptoms of a more serious underlying deep-seated structural problem. My view is that and work has been done, very good work has been done by this task team, and I know there have been many task teams that we've had, but I'm fairly happy. It's an external group of people, some appointed by the Minister of Health, some internal people, and they've actually been doing. They've taken previous diagnoses. And they've now and the existing diagnosis, and basically they've crafted a 5-year plan. They're saying quick fixes don't help. We need deep-seated structural changes in the entire health system, in this massive supertanker that we're actually dealing with. But I think that there are, and Rob might be right here. There might be some things that we can fix in the short term, in the COVID response. But I don't think that we can fix everything. I mean, the deep-seated problems immediately, and I think that's an important point to make. So, to use the war metaphor that was used earlier on, I mean, when the war, when the guns go silent, as it were, on COVID, I mean, then we'll really have to focus on fixing the health department over the course of the next couple of years. And I think, that articulation is there. For example, let's take the issue of data that everyone complains about. I can tell you that we're not going to fix the data problems, the collection of data, the setting up the systems, the health information system, etc., during COVID, because you're not on the front line firing the gun against the COVID enemy, to use that metaphor. So I think that, so we have to understand that, and let's hope that the COVID thing in the next things we get so-called herd immunity, if that's achievable. I think we need to then implement those structural changes.
Great. Thank you very much, Rashid. I want to go back to Graeme. He mentioned horizontal convergence. Would you like to elaborate on that and perhaps give us some ideas on how we can achieve that?
Sure, and I can talk a little bit in answer to Ishmael's question and time. I think it is possible to arrive at a set of arrangements in government where one is looking after the routine functions, but at the same time focusing on particular purposes or priorities that make for business unusual and different ways of getting the job done. But that different way of getting the job done needs to be understood as itself needing to be systematized or routinized, and it's called program management. Now, I'm picking up on points from Michael earlier, where he was saying one of the fundamental problems in government over the last couple of decades has been our inability to set priorities and pursue those priorities in an appropriate way. When one does program management properly, you set the priority, and that priority sets a cascading set of responsibilities across the divisions of government so that everyone comes together to focus on the same set of outcomes. And I think that's really what one's looking for here. One has to draw a distinction between program management, which brings different departments together, and the establishment of a program management office. And typically we default to understand the need for program management to require the setting up of a program management office. Sean, if I may, this is a little bit of me playing the devil's advocate, but when I look at the mandate of Operation Vulindlela, and I look at the different things that you need to take charge of, everything from water regulation and pricing to sorting out the divisionalization of ESCOM, sorting out the bandwidth, etc. it terrifies me. How can one office take charge of all of that set of things? So when we think about program management, we're not thinking about, I argued, the setting up of a program management office that does all the priorities at the top of government. Rather, we're talking about the setting of programs, pursuing particular priorities that mean everyone needs to come together. And this is both horizontally and vertically as well, bringing the different parts of government together around the same program purposes. Now, that's something we don't do well, is a point that I would like to argue. I do want to emphasize the point here that it's not just horizontal coordination. Vertical coordination is very, very important here. And I think one needs to look very, very seriously in the COVID crisis at the relationships that were forged between the National Department of Health and the provinces in terms of structuring responses. I've been part of various processes in which there was a deep sense of frustration that the National Department of Health did not trust anyone else, the provinces, etc., local governments and other players, to be co-responsible in tracking the crisis through the sharing of data and responding appropriately in a joined-up way. I've lost sound. I don't know about the rest of you.
Oh, okay. I'm saying Graeme is suggesting program management, which is another way of addressing that horizontal as well as vertical convergence. So earlier, Sean talked about the strategic leadership, where leaders in the strategic positions get involved with operational issues during crisis. So I'm asking Sean to perhaps link the two and see how program management then could be what drives the strategic leadership during the time of crisis.
Can you hear me?
Yeah, I can hear you.
Okay. Yes, I don't think management can drive it. I think strategic leadership and management need to use program management as a management tool. Mm-hmm. That's all program management is. It's a management tool. But you need the leadership and management. You need people at the top who are willing to get their hands dirty, who are willing to drive things, and they're better able to do that if they have knowledge of program management. But the leadership and top management must come first.
Great. No, thank you for that comment. And going back to Michael regarding his question on crisis, whatever interventions that we put in place during crisis, will they still operate or be relevant when we get to normality? How would this be addressed using those principles of program management?
I think I'm probably not best placed to answer, because I think it's the practitioners, it's those in the studio there with you that should be answering that question. And in a sense, Rashid was already pointing in that direction when he was saying, for instance, in the health sector, he said something along these lines that the kind of silos within the department seem to be overcome to some extent in the course of the COVID crisis. If that's the case, then that's certainly something that should be taken forward out of the crisis and built upon. So I think the point would be that those who are at the coalface, and I'm not one of those anymore, or for the moment, need to be able to distinguish between those practices that have emerged during the crisis that need to be built on and sustained into the future, and those things. So, because I think there's a sense in which crisis can be a refuge. It enables you to kind of get away from the stuff that has been bugging you for a long time and say, well, that's no longer important. I don't have to address it. So I was interested with what Rashid was saying, that some of the crisis structures have become onerous meetings. So Sean told us how in the midst of a crisis in Limpopo, some important key players were saying, no, I've got to do my APP, therefore I can't respond to the crisis. But on the other hand, you can have crisis structures that then enable people to say, no, I can't address maintenance or procurement because I'm busy dealing with this crisis. Mm-hmm. So, from the outside, I can talk about those principles, but the practical application of those things really needs the people in the system to contribute.
Thank you very much, Michael. In fact, Rashid wanted to address that and make some comment.
Yeah, just on and maybe this is more for Sean, and Ismail and Kamel can also comment. But I don't know if you saw this article by Dr. Jacob Eba Umar in the Business Day about 3 or 4 weeks ago, where he spoke about this government, years government going on again about establishing another unit. I think he was referring to your unit, Sean, and say this is now one of these plethora of units trying to solve service delivery. He was being very dismissive. He's my friend, by the way. I should disclose that. And I told him yesterday, I said I didn't want to spat with you on WhatsApp. It doesn't help in a group, nohow. And but it was in this Business Day article. But I think that certainly the work that we've done, and this relates to the issue of delivery units and the idea of the center of government that we were talking about early on, the interrelationship between those elements. I think that we have advanced the thinking in the case of, I think, government institutions that are failing, and we are very far from the idea of a capable state. And I think that to provide that extra support to departments, is quite critical. So I don't know, Sean, whether you saw that article and whether you had any thoughts about it, because I think maybe we need to respond. Because you see, my view is that when people talk about government in a dismissive way, it's very difficult to contradict. And I think if we have a sort of an approach that responds to it, it's not unrelated to the work that we're doing at the moment in the whole COVID response. It's very much integrated into that kind of thinking. But I thought maybe Ismail and Kamel might also want to comment on that, as well as Sean, through you, Chair.
Great. Thank you very much, Rashid. I'll ask Kamel to comment before the panelists.
Yeah. Look, I think, well, firstly, just to say thank you so much to all the contributors this morning. I think it's been an incredibly interesting and thought-provoking discussion. And certainly highlights a lot of the things that we've been saying. And I think sometimes, and maybe I think yesterday might have come across as if we're painting quite sort of a positive picture about what has happened over the last year. But I think we're also recognizing some of the failures. And I take on board a lot of the points that the colleagues have made around how we sometimes get comfortable in a time of crisis. So kind of indirectly coming back to Rashid's point, we get comfortable because we can then have an excuse for why we weren't able to do the other things, maybe the kind of routine things that we are meant to do kind of on a daily basis. So for me, I think, yes, we're not suggesting that we have the answers right now. We want to take, and we're not sort of naively saying that through this crisis we've responded so well that we've learned these amazing lessons. But I think there are important things that we must reflect on to see how we take them forward, and maybe to understand what the conditions were that allowed us to be able to do some of these things. I think even when we look at our later case study around the stuff that we've been able to do around health infrastructure in particular, because I do think there are key important lessons, and we're not saying that obviously the overall picture is a great one. But for me, I think the thing that we maybe haven't reflected enough on, and I think it has come through actually in our case study through the work that was done by the GCRO, was around interrogating and understanding why the long-standing sort of challenges and the intractable problems that we've been dealing with, as Michael was saying, for decades, why we haven't been able to deal with them effectively. I think sometimes it has been a failure on our part around interrogating and really coming to grips with that. So I think, Rashid is making the point with the work that we're doing in the health department and the setting up of that provincial strategic support team, that we will, it is about reflecting on the deep-seated and the structural issues that we need to deal with. So it's not kind of just dealing with stuff at the level of the surface and kind of superficially responding to some of those challenges. So I would actually like to challenge ourselves, and at the moment it feels like we're just talking to ourselves as Gauteng, because we're not hearing the other voices in the conversation, Chair. But I would really like to challenge ourselves as well as the other provinces to start to really interrogate and to have these conversations about how do we, once we kind of get beyond the crisis, as Rashid said, the silencing of the guns, what is it that we want to take out of this with us? I've been saying for the last few months that, sometimes I get the sense that we're waiting out the crisis. We're kind of waiting to get over the speed bump, whereas I think what we should be doing is reflecting on what the crisis is supposed to teach us, and what those lessons are, without trying to sound philosophical about it, but in a practical way, what are the things that we can actually learn and take with us out of the crisis, at the same time giving ourselves space to really interrogate and obsess about why we haven't been able to deal with the long-standing issues. And I wanted to then also challenge us and even the colleagues that have contributed this morning to say, come on board with us to do that work. We've already started this morning. You've provoked us to start to think about things differently as well. And so it's also about saying, how do we collaborate beyond just the boundaries of government with yourselves, to help us to really to provoke us firstly to get to think around these issues, but then to help us to jointly problem solve around some of the stuff. So for me, that's kind of the takeaway from that for me.
Great.
Thanks.
Thank you very much, Kamel. I'll go back to the panelists and ask them for a few seconds, each one of them say, what's the way forward? What should we be doing going forward? Starting with Rob. Okay, Rob, perhaps you didn't. Oh,
I think one of the most valuable things that has been set in place by the Premier's office in Gauteng has been the ethic of a learning organization. From the very beginning of the pandemic, they've kind of emphasized this reflective culture, and that's been a really important part of it. The combination of innovating governance and deliberately thinking, reflecting, drawing in partners in learning, I think has been a really important part of that whole dynamic. And so I think that the more that can be done deliberately in systematic ways, that is probably one of the most useful things to underpin both getting routine government better in better condition, as well as being able to equip us for more adaptive practices into the future.
Great. Thank you very much, Rob. And Graeme, final thoughts?
The GCRO is set up as an organization that's meant to inform governance of the city region, a 15 million population region that contributes a third of the region, of the national economy. And the ideal here is that different parts of government, national, provincial, and local, and in particular, provincial and local, work together in order to develop that region in a joined-up fashion. And I think the learning from the pandemic, more than anything else, is that the relationships between provincial and local government should not be driven by fear, should not be driven by a sense that local government is somehow a stock full of enemy agents from a foreign government, which is often the way in which we think about different parts of government. What the pandemic has taught us in the way in which we've responded in these agile structures, not always adaptive structures, is that it's really, really important, and it's really not that hard to bring the different players together into the same room around these common purposes that Rob talks about all the time, and which Michael has emphasized in his inputs here. Thank you.
Great. Thank you very much, Graeme. And Micah?
Well, I think the one is what was highlighted by Ishmael earlier in his input, which that really this idea of a learning network between Premier's office, I think, is very valuable. But I think that we need to, when we think about the center of government, we shouldn't confine that to the Premier's office. That in provinces, the provincial treasury, the provincial structures of COGTA, and probably the public works department or the infrastructure department are critical elements of that center of government. And you need a learning network between Premier's offices, but you also need closer collaboration and coordination between those offices to constitute the center of government in the province.
Great. Thank you very much for that, Mark. And Sean, last comments?
Yes, thank you. I agree absolutely with the skeptical view of setting up new structures, particularly they take over roles and responsibilities of existing structures instead of fixing existing structures where they're not working properly, or existing departments and organizations. But I don't think that means that the centre of government and the Premier's offices and the presidency shouldn't be capacitated to play the roles that they need to play at the centre to make sure that key strategic things happen, to monitor whether things are happening or not, and to intervene where they're not happening. So I think the key lesson for me from this case study is that the Premier's office in Gauteng did seem to be able to do that and play its role. It's just unfortunate that it had to set up a new structure to be able to do it, instead of using the existing disaster management structures, which focus should be now on making those existing disaster management structures work properly, so you don't have to set up a new structure again next time there's a crisis.
Great. Thank you very much, and need to thank our panelists for those insights and reflections. And lastly, then go to Kamal, Ismail, and Rashid. Final comments?
Okay. Thank you so much, Thabo. I think the points I made earlier on were actually the points for me. And as I think we said yesterday as well, that this is the start of a conversation. And I think it's an important start, and I think it's actually a really great start. And so I'm really appreciative of everybody that's contributed to this work. So thank you so much to the colleagues.
Great. And Ismail?
Thanks, Thabo. So I'd like to just say, I think that the case study we're presenting next would be quite interesting based on this discussion. Because I think what we've learned from that case study is how the Office of the Premier, as Sean mentions, can actually intervene, bring the right players together and problem solve. I think, Chair, you also asked the question earlier around how do you get people or units involved that are reluctant to get involved. Mm-hmm. And I think through that process, you're able to lean onto the head of the DSU, you lean to the Director General is available, and you escalate problems. And that's one way through that escalation process where you get commitments from people who are reluctant. Mm-hmm. So, I think you are able to build then a grouping of individuals from different institutions who are single-minded and focused to address a particular problem. So I think the next case study that we will be talking through will kind of show that in a practical way, how we actually done that. Thanks.
Thank you very much for linking that. Yes, Rashid.
Yeah, but
Final
just two
comments.
brief points. I think the one, I mean, from our point of view, there's always been this agenda of building the Gauteng city region, not just the province. And I think that what has happened helps us move in that direction, to move towards, I think, much greater levels of intergovernmental cooperation and so on, so that we can think of ourselves as a region, obviously with different spheres of government and individual sort of municipalities and the provincial government, and also working with national government. So I think that's not on the agenda. It might apply to some extent to the Western Cape and KZN, but it's certainly those parts of the country that has I forget what they call the national, I think urban centres or something like that. I think, I mean, this is an important part in shifting that agenda. And the final thing I wanted to say to Sean is that I think we should write an op-ed article in the Business Day talking about the issue that we around, I mean, this is not a defensive mode, but basically saying that we need to think about how the centre of government works, as well as, delivery units, etc. So that might be something to do pretty soon. Thank you, Chair.
Great. Thank you very much, Rashid. And thank you to our panelists connecting online, including our attendees and the colleagues in studio. At this point, then we'll take a comfort break till 11:30. Thank you very much.